Hello everyone, welcome to KAPS Recalls discussion starting with question number 96. Lomotil should not be given to patients taking oral clindamycin because the options are the antimicrobial action of clindamycin will be impaired, aplastic anemia may be more likely to occur, an insoluble complex will be formed, toxic effects of clindamycin may be enhanced. So what is this Lomotil? Lomotil is a brand name for combination of diphenoxylate and atropine. So it's used for the treatment of diarrhea, and this clindamycin is an antibiotic. So here the correct answer is option D. That is when this Lomotil, when given together with this oral clindamycin, toxic effects of clindamycin may be enhanced. The development of inflammatory conditions of the colon, for example, non-specific colitis or a more severe pseudomembranous colitis has been associated with antibiotic therapy, especially clindamycin. Although many antibiotics have been implicated, there have been a disproportionate number of reports specifically involving clindamycin and lincomycin. Colitis has been associated with both oral and parenteral administration of these drugs, and no clear predisposing conditions have been identified. Because antiperistaltic drugs, for example diphenoxylate, used to treat the resulting diarrhea seem to prolong the disease. That is the reason why this combination should be avoided or they should not be used together. Next question. Colloidal mercury was used in the treatment of. Options are syphilis, gonorrhea, pertussis, meningitis. So here the correct answer is option A, that is syphilis. In 1926, colloidal mercury sulfide was reported to possess excellent healing and definite sterilizing properties in syphilis, produced experimentally in rabbits, and was deemed worthy of an adequate experimental study in the therapeutics of syphilis in man. Moving on to the next question. Congo red is used in the detection of. The options are multiple sclerosis, amyloidosis, pyelonephritis, blood cells. So here the correct answer is option B, that is amyloidosis. So we know that this Congo red is a synthetic dye. It is used for the differential staining of elastic fibers. It is a gold standard technique for the detection of amyloidosis. So what is this amyloid? Amyloid refers to the abnormal, fibrous, extracellular proteinaceous deposits found in organs such as kidney, spleen, liver, etc. The deposition of amyloids in the tissue is known as amyloidosis. In histology, the Congo red is used for staining amyloidosis, other amyloids in cell walls of plants, fungi, and outer membrane of gram-negative bacteria. Next question. Which among the following drugs inhibit the metabolism of warfarin? The options are rifampin, phenytoin, griseofulvin, voriconazole. So here the correct answer is option D, that is voriconazole. So one of our previous discussion video, we have seen about the enzyme inducers as well as enzyme inhibitors. So among these options given, this rifampin, phenytoin, griseofulvin, all these are enzyme inducers. Okay, only the voriconazole is an enzyme inhibitor. Voriconazole is an inhibitor of CYP2C19, 2C9 and CYP3A4 isoenzymes. Remaining all drugs are enzyme inducers. Okay, so the last question of this series. Which of the following best describes the common clinical manifestations of hypoparathyroidism? The options are hypercalcemia and hypochlorhydria, hypocalcemia and hypophosphatemia, hypercalcemia and hypophosphatemia, hypocalcemia and hyperphosphatemia. So here the correct answer is option D, that is hypocalcemia and hyperphosphatemia. Hypoparathyroidism usually presents itself as a disorder of calcium metabolism in which serum calcium levels of the patient decrease while levels of phosphate increase in an inversely proportional manner. Low serum calcium levels may precipitate a potentially serious condition known as tetany. So to prevent the development of this disorder and to treat the hypoparathyroidism, calcium supplements such as calcium gluconate, calcium carbonate or calcium lactate may be prescribed. So with this question, we have completed today's recalls discussion. Thank you for watching this video. Have a good day.